Hi everyone, my name is Dr. Purvi Patel. So the healthy aging formula, what should it be? As patients 65 and older continue to increase over the next 20-30 years, what should our healthy aging formula be for our patients? So in our practice and in my practice, what I recommend is my 4 favorite modifiable risk factors, and those include healthy diet, physical exercise, and cognitive exercise, as well as socialization. And so, we're going to start off with the case scenario today. And so the case scenario is my 71-year-old patient who had come in with cognitive impairment, history of TIAs, hypertension, hyperlipidemia, episodic speech disturbances, anxiety, GERD, prostate CA, and urinary incontinence. Over the last 2 to 3 years, he started noticing difficulty with memory and word retrieval, and this was progressively getting worse. So cognitive difficulty was worsening his anxiety, as well as he felt inadequate in public setting. And so his meds included amlodipine, lisinopril, Eliquis, a statin, as well as oxybutynin and a multivitamin. His physical exam was within normal limits. His MoCA test showed a score of 25 out of 30, points lost in short-term recall, as well as Trailsby he did well in. He scored a 129 out of about 300. GAD-7 score was 13, which did indicate severe anxiety as well in his patient. His labs were within normal limits, including his B12, folate, RPR, TSH, as well as a Lyme test. MRI of his brain with and without contrast showed multiple white matter hyperintensities, as well as age-appropriate global atrophy. And so, the question always comes up, how can we optimize and preserve brain function? And so by optimizing the quality of our life, rejuvenate ourselves by eating a healthy diet, physical exercises, cognitive exercises, as well as socialization. And so, we're going to break that down here in a little bit. And so why should we optimize our brain function? It is to help maintain independence. We want patients to live at home for as long as they can and remain as independent as they can. And so, what's healthy nutrition? Following some dietary guidelines, may reduce the risk of dementia, as well as heart disease and diabetes and cancer. So conclusions in some studies, there have been studies done on this as well. And some of the conclusions are that diet that was predominantly high in fruits and vegetables, whole grains, fish, healthy, diet, which is low in red meats and less dairy, showed reduction in overall death. It showed reduction in overall heart attacks, as well as death from cancer, and reduced the risk of having Parkinson's disease, as well as Alzheimer's disease. And so what are some other studies? The Sprint Mind study published in 2019 in the New England Journal of Medicine found that intensive blood pressure control reduces the risk of cognitive impairment and dementia. Framingham Heart Study, ongoing since 1948, basically found that the risk factors for heart disease, such as blood pressure and hyperlipidemia, are also risk factors for cognitive impairment as well as dementia. And so most recently in the Lancet in 2020, July 2020, they studied 12 modifiable risk factors, and they saw that cases were reduced and delayed by targeting these 12 modifiable risk factors. And they included my personal favorite, which was physical activity, of course, which helps reduce hypertension. It reduces obesity, it reduces the risk for diabetes, as well as small microvascular infarcts to the brain. And so they also included ETOH use, which should be none after a certain age. Alcohol can definitely be damaging to our brains. I have had countless patients where they come in, they want to drink wine and essentially, or they want to have, a drink every day. And those patients are definitely cutting back on their alcohol intake. They also, so the Lancet study also included tobacco use, social isolation, another favorite of mine, and physical inactivity, as well as air pollution, which can also affect how we are, our well-being. And so, you know, what is a good diet? What are some of the recommendations for healthy diets out there? Anti-inflammatory diet is my personal favorite, along with the Mind diet and the Mediterranean diet. But the goal of all of these diets is to aim for variety and keep all the diets high in fruits and vegetables. We want fresh food as much as possible. We want to eat plenty of, you know, whole grains, brown rice, it could be quinoa, it could be beans, legumes, you know, any vegetables that you want. We also want to include probiotics in our diet. Prebiotics are essentially your fiber-rich fruits and vegetables, and then you want to include probiotics, which includes your kimchi. It could be sauerkraut that we have here in South Central Pennsylvania. Yogurt or yogurt-based drinks, they are all great. Kombucha, there's a lot of variety out there that you want to include to keep your gut healthy. Probiotics keep our gut healthy, which, you know, in our gut is where we make 90% of our serotonin, which is our feel-good neurotransmitter. And when we feel good, we want to do more, and it just becomes a healthy habit. And so we also want to minimize, you know, the one big key factor is minimizing white sugar, processed, you know, white flour, and that can all cause inflammation and chronic disease. And so also we want to include in our diet omega-3 fatty acid rich foods such as salmon, sardines, herring. If you're a vegetarian, you know, you can have hemp seeds, flax seeds, avocado, walnuts, and or almonds. You know, those are all high in omega-3 fatty acids. Or you can just supplement with an omega-3 fatty acids. So we've got fish oil, krill oil, or for the vegetarians, algae oil, which is where, you know, it originates. And so you want to keep these supplements high in EPA as well as DHA, and that helps our brain function better. It also, you know, has been studied in the past as well. It's also good for heart health. So the Mediterranean diet, you know, Nurses Health Study, BMJ 2014, Mediterranean diet was associated with longer telomeres, a biomarker of aging. It seems to be mediated by the antioxidants and the anti-inflammatory effects of the diet. You know, longer telomeres seems to be associated with longevity, you know, and so healthy oils. What are some healthy oils? You know, and they have been studied as well and have been found. And there's a journal article in the Cardiovascular Pharmacology Journal which shows that in December 2009, it increases good cholesterol. Healthy oils such as olive oil increases good cholesterol, decreases total cholesterol, decreases bad cholesterol, your LDL, reduces your blood sugar. It can reduce, all of that can also help reduce your blood pressures. You know, by reducing our blood pressures, we're reducing those silent cerebral infarcts, you know, those white matter changes that we see in the brain when we check on MRIs, the global atrophic changes that occur. How can we optimize brain function by physical exercise? You know, gait and balance, of course, is near and dear to geriatrics. It continues to allow us to have ability to perform our activities of daily living. Research is finding that staying active is one of the most potent ways to keep your brain sharp and the mood bright. Of course, you know, and how does that occur? By releasing all the healthy neurotransmitters, you know, the dopamine release, the serotonins. And so, is it ever too late to improve functional impairment? No, never. That's what I tell my patients, you know, when they come in, we go over those 4 recommendations. Absolutely have to include physical exercise. It improves your blood flow to the brain, more oxygenated blood, better for the brain, more nutrients to the brain. Physical exercise is always beneficial. It decreases all-cause mortality. And so even the American Geriatric Society outlines an additional program in its exercise prescription for older adults with osteoarthritis, training in flexibility, strength, and endurance. It doesn't all have to be done in one day, but you can break it down by, if you're going to do strength training for 2 days, you can do endurance for 2 days, and then there's flexibility. Flexibility can be added on each day for 5 minutes, or, do what you like. Walk for 10 minutes if you're not doing anything. Just any movement is good for our body and good for our brain. And so the next thing is usually cognitive exercises. What do they do for us? They help rejuvenate, rewire, they regenerate. It allows for increased neuronal growth. It revitalizes our brain. It helps stabilize and improves the cognition. It keeps our brain healthy. What are some cognitive exercises that everyone loves? Word searches, word games, Sudoku, crafting, yard work, there's crocheting. There's a lot of different activities that we can suggest for our patients that can continue to keep their brains healthy. Learn new skills, challenge the brain a little bit. When you challenge the brain, it learns to rewire itself. It kind of works around, the blockage and finds new ways to improve all of its thinking skills. And so social engagement is the fourth modifiable risk factor that I always allude to. And why is that important? Social activity supports our brain health and may improve or delay cognitive impairment. It's associated with living longer with fewer disabilities. And so that could be faith-based, family-based, or friends-based. We want to keep it healthy. Now, there are patients that are introverts. I cannot force them to do the socialization. If they're happy just being by themselves, that's okay. But we have seen during the pandemic, patients that were socializing and had to stop, we saw increases in depression. And so encourage joining a group, join a club, anything to keep active and healthy. And so in summary, together with regular physical exercises, cognitive exercises, social engagement, and eating right, we can improve our brain health as well as our heart health. Heart health is, equivalent to brain health most of the times. A lot of the times, anything that's heart healthy is also brain healthy. And so our brains possess a tremendous capacity for experience-dependent neuroplasticity. So, even as we age, we develop neurodegenerative disorders. There's still ways we can work around it by keeping the brain active, by doing cognitive exercises, physical exercises. And so there's, no percentage graph that correlates how much each of these risk factors improves brain health, as benefits can vary depending on many different factors. Adopting a healthy lifestyle can have a positive impact on the brain and improve cognition. So going back to my case scenario, we have, I assessed him with mixed dementia, and that included vascular dementia and Alzheimer's type, 2 very common types of dementias. So I started him on 5 milligrams of donepezil, which at times we have seen it improves mood and anxiety as well. And in his case, because it's mixed, it could help his mild cognitive impairment as well. So in review of his medications also, I discontinued his oxybutynin, which can have potential to reduce the anticholinergic burden. And so anticholinergic medications can cause worsen confusion. And so we're always looking at medications when we see patients in our office. And so in follow-up, patient was much clearer. He was completely a different person. He was back on the golf course, driving his golf cart, and very confident. Was able to interact with everybody. He was shy prior to that, and he came back. He was just completely rejuvenated. He was so excited. He's like, I can't believe, why there's not more of this that's being recommended. And so, in discussion, physicians are often focused on acute treatments. We want to discuss preventative health as well. Always try to include the preventative health piece in every time you see the patient, and it's never too late or too early to start. Thank you, and as always, it's always a privilege taking care of each and every one of our patients. Have a great day, everyone. I hope this helps.